Okay, we are going to be discussing cutting and clamping the cord. So we've got our baby here with their umbilical cord, and when cutting the umbilical cord, you're going to wait at least 1 to 3 minutes postpartum. We're going to wait for the cord to stop pulsing, so the baby is receiving all of the benefit that there is with the blood that is being transferred from the placenta to the baby. So we are going to need 2 clamps of some kind. So I've got these hair clips that are representing our clamps. You can have two cord clamps. You can have a clamp and a hemostat. You can have a clamp and an umbi ring. You can have a hemostat and an umbi ring. There are a lot of different combinations, but we've got these 2 clamps, so they're representing our umbilical cord clamps. So we're going to place the clamp about 2 finger breadths away from the baby's belly. So we're going to place that first one there. And then we're going to place the second one about an inch or so away, just so that we've got enough space that we can cut the cord. So we've got those 2 clamps on there. And when we are dealing with baby, we're going to be wearing gloves. So I should have had my gloves on already. My pouch would already be open, and we would have it open with our sterile scissors. So we've got our pouch open with our scissors to cut the umbilical cord. Okay. So the things that we need for cutting the umbilical cord, we need our clamps, we need our sterile scissors, and we need some gauze. So I've got this washcloth that is going to be representing our gauze. You're going to put the gauze underneath where you're cutting the cord so that it'll catch any blood splatter. The longer you wait to cut the cord, the less blood splatter there is going to be. So taking our scissors away from our sterile field, if a parent or a sibling or somebody else is cutting the cord, you will want to advise them that cutting the cord is going to be like cutting through a thick rubber band. So it will take several bites of the scissors to cut through the cord. So cutting the cord, we're going to take those bites through that chewy rubber band, and then we'll place the scissors away. If you have an assistant or if the parent is cutting the cord, they will hand you the scissors. And then you can place the placenta and the umbilical cord in a bowl or a bag to be taken care of, and you'll dab the blood away from the cord. It can be trimmed shorter so that it's right there at the clamp. That's usually preferred, so you can trim that before you take care of the scissors, and it'll be nice and short for the parents. And then cord care. You want to keep the cord clean and dry. So when you are putting on a diaper, if there is not an umbilical notch, you'll want to fold it down to keep it away so it doesn't go into a soiled diaper. If you choose to bathe your baby in the first about 72 hours postpartum, you may want to consider doing a sponge bath to keep the umbilical cord, the cord and umbilicus dry. You can clean baby, but you want to try and keep that nice and clean and dry. The more dry you can keep it, the better it'll heal and it'll fall off. If you notice any discharge infection or stink, you can apply golden seal powder with a Q-tip around the umbilicus, just right in there, and that'll help prevent any infection. You can also use myrrh essential oil, and that will help. You can put that right here on the top of the cord, and that'll help it dry and fall off in a timely manner. You also really want to just let the cord fall off in its own time. Resist the urge to kind of play with it, especially as it starts to get dry and begins to detach. Resist the urge to encourage it to come off. Just let it come off on its own. It'll help prevent any damage. there is our sweet baby with their cut umbilical cord.